that might be less invasive.
I'm open to alternatives, but haven't found much information. Could you provide some guidance on those?
I'll provide you with detailed information on each, and we can discuss further.
Doctor, I appreciate your understanding and the information. I want to avoid considering all my options.
Absolutely. Making an informed decision is crucial, and I'm here to support you through this process. Let's schedule another appointment to go over the alternatives in detail. Your health and peace of mind are our top priorities.
Now look at question 26.
Being aware of the initial symptoms is key to managing asthma effectively. Early signs include increased shortness of breath, wheezing, or a persistent cough, especially at night. You may also notice a feeling of tightness in your chest or increased fatigue during physical activity, which are indicators that your asthma may be worsening. Another important sign is the need to use your quick relief inhaler more often. If you find yourself reaching for your inhaler more frequently, this is a clear sign that your asthma is not well controlled. Additionally, monitoring peak flow rates can help detect decreases in lung function before it becomes critical. It's important to act quickly if you notice any of these signs. Adjusting your medication, consulting with your healthcare provider, and avoiding triggers are essential steps.
Now look at question 27.
I understand how hard these conversations can be, and I appreciate you taking the time to discuss your loved one's care. Given the progression of their illness, we need to consider palliative care.
It's really tough to hear that. What exactly does palliative care involve? Will he still receive treatments for his condition?
Palliative care is designed to provide relief from the symptoms and stress of a serious illness. The goal is to improve quality of life for both the patient and the family. Your father would still receive medical treatment for his symptoms, but the focus would shift to managing pain and discomfort rather than trying to cure the illness.
Would he be able to stay at home, or would he need to be in a hospital?
Palliative care can be provided in various settings, including at home, in a hospital, or at a palliative care facility. We can work together to decide the best environment for him based on his needs and your family's preferences.
Thank you for explaining that. It's a lot to consider, but it sounds like it might be the best way to ensure his comfort.
Absolutely, and we are here to support you and your family through every step.
Here's how you can save some of your time. The easiest way to score top essay marks like this is to just ask Grammarly to find gaps in your essay. It basically suggests areas for further reading and helps make your arguments more well-rounded and critical. If citations take up too much of your time, there is an auto-citation tool that pops up when you have the extension installed. And yes, these are all free features. As you know, Grammarly can help you with email drafts. But if you upgrade to Grammarly Pro, you can get access to tools that can turn your wordy sentences into clear, effective ones with just a few clicks. And now, if you ever need to prove that your work is your own, they've added an authorship feature that shows whether your writing was done by you, AI, or edited through Grammarly. The link to create a Grammarly account will be below.
Let's set up a time to meet with our palliative care team to discuss everything in detail.
Today we're going to discuss how to develop a mental health crisis intervention plan, an essential tool for anyone facing mental health challenges or supporting someone who is. A well-prepared plan helps to act swiftly and effectively during a crisis, potentially saving lives. First, let's discuss identifying the warning signs. These can vary widely, but often include sudden changes in behavior, expressing feelings of hope from social interactions. Recognizing these signs early can be crucial. Once signs are identified, the next step is immediate action. This could mean contacting a mental health professional, reaching out to a crisis hotline, or initiating safety protocols if there's a risk of harm. Everyone's crisis plan will look a bit different, tailored to their specific needs. It should also include a list of contacts, family, friends, therapists, who can be reached during an emergency. Lastly, let's talk about maintaining the plan, keeping it updated and rehearsed. Does anyone have questions or examples they'd like to discuss on how to tailor a crisis plan?
Now look at question 29.
Hello, I'm here to help manage your medications during your hospital stay. Let's start by listing all the medications you currently take. This includes prescriptions, over-the-counter drugs, and any supplements.
All right, I take a statin every evening for my cholesterol, and I have a prescription for blood pressure twice a day.
Thank you. Do you take any over-the-counter medications regularly?
I occasionally take aspirin for headaches and melatonin to help with sleep. Should I mention the vitamins I take as well?
Yes, please include everything, even vitamins and herbal supplements. It's important to ensure there are no interactions with the medications we might need to administer during your stay.
I take a multivitamin, vitamin D, and a fish oil capsule daily. I also started taking CBD oil recently. Is that relevant?
Absolutely. Everything you take can have potential interactions. Thanks for being thorough. Let's make sure we have the correct dosages for each, and then we'll discuss how we can manage these during your stay.
Now look at question 30.
Welcome to today's training session on the Hospital Incident Command System, or HICS. This framework is vital for organizing and managing response efforts during incidents of all sizes within a hospital setting. The HICS structure is designed to help us assign responsibilities clearly, manage resources efficiently, and respond to incidents effectively. Key positions include the incident commander, who has overall responsibility for the incident, and section chiefs for operations, planning, logistics, and finance administration. Each role has specific functions. For example, operations manages tactical operations aimed at reducing the immediate hazard. Planning is responsible for collecting, evaluating, and disseminating information about the incident. Logistics provides resources and services to support the incident, and finance administration manages financial aspects and record keeping. We will go through each role in detail, discuss their responsibilities, and then participate in a simulation exercise to see how these roles interact during an incident. Are there any questions before we begin, or specific scenarios you would like to discuss in our simulation?
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Today, we're diving deep into the complexities of managing type 2 diabetes, a prevalent chronic condition that affects millions worldwide. we'll explore the nuanced relationship between diabetes management and the development of diabetic neuropathy, a common but often debilitating complication. We're also going to look at a particular case study that highlights the challenges and strategies for managing this condition effectively. Type 2 diabetes is characterized by insulin resistance and relative insulin deficiency. Over time, poorly managed diabetes can lead to a range of complications, including cardiovascular diseases, renal impairment, and diabetic neuropathy. Diabetic neuropathy, in particular, presents a significant challenge due to its impact on mobility, leading to decreased quality of life and its contribution to morbidity in diabetic patients. Neuropathy in diabetic patients manifests primarily as peripheral neuropathy, where patients experience loss of sensation, pain, and sometimes injuries that they cannot feel, leading to infections and complications. The pathophysiology involves glucose-induced damage to the nerve fibers, particularly the small blood vessels that supply these nerves, leading to ischemia and nerve cell death. Now, let's discuss a case that illustrates these challenges. Consider the situation of Mr. Smith, a 60-year-old male with a 15-year history of type 2 diabetes. He initially managed his diabetes with oral hypoglycemics, but had poorly controlled blood glucose levels. Over the years, Mr. Smith has developed peripheral neuropathy, which he first noticed as numbness in his toes and feet, progressing to painful tingling sensations that disrupt his sleep and mobility. In managing a patient like Mr. Smith, it's crucial to approach his care holistically. First and foremost, tight glycemic control is paramount. Studies such as those published in the New England Journal of Medicine have consistently shown that maintaining blood glucose levels within a target range can significantly slow the progression of neuropathy. Mr. Smith's management would therefore include adjusting his medication regimen, possibly incorporating insulin therapy to achieve better glycemic control. Next, pain management is crucial for improving quality of life. Antidepressants like duloxetine and anticonvulsants such as pregabalin are often used to manage neuropathic pain and have been endorsed by guidelines from the American Diabetes Association. For Mr. Smith, starting on a low dose of pregabalin and titrating up based on his pain relief response and side effects could be a viable strategy. Patient education and regular monitoring play critical roles. Mr. Smith should be educated on the importance of foot care to prevent injuries and infections, which he may not notice due to reduced sensation. Regular podiatry visits should be arranged, and Mr. Smith should be taught how to inspect his feet daily for any signs of injury. Additionally, lifestyle modifications can have a substantial impact. Dietary adjustments to manage blood glucose levels, combined with regular physical activity, can improve insulin sensitivity and contribute to overall nerve health. Mr. Smith should be encouraged to work with a dietitian and a physiotherapist to incorporate these changes in a way that is sustainable and effective. Managing diabetic neuropathy involves a multifaceted approach that includes optimizing glycemic control, managing pain, educating the patient, and encouraging lifestyle modifications. Each patient's management plan must be tailored to their specific needs and circumstances, as demonstrated in Mr. Smith's case. By following these principles, we can help patients like Mr. Smith not only manage their symptoms, but also significantly improve their quality of life.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, and welcome to today's healthcare discussion, where we delve into the intricate relationship between HIV management and cardiovascular health. Recent advances in HIV treatment have significantly improved life expectancy for individuals living with HIV. However, this success brings new challenges, particularly in managing long-term comorbidities, such as cardiovascular diseases, CVD. Cardiovascular diseases are now a leading cause of morbidity and mortality in HIV-positive populations, which is thought to be due to a combination of HIV infection, antiretroviral therapy, ART, and traditional cardiovascular risk factors. Today, we'll explore this complex interplay and discuss strategies for cardiovascular risk management in patients with HIV. The case of John, a 54-year-old male with a 20-year history of HIV, underscores the challenges at the intersection of HIV management and cardiovascular care. John was diagnosed with HIV in his 30s. Thanks to effective ART, his HIV has been well controlled with an undetectable viral load and a stable CD4 count of 650 cells per millimolar. However, during a routine checkup, it was discovered that John has developed hypertension and early signs of coronary artery disease. Let's start by understanding why individuals like John are at an increased risk. Research indicates that HIV-infected individuals are at a higher risk of developing CVD. This risk is multifactorial. Firstly, the virus itself contributes to this increased risk. HIV promotes inflammation and affects the endothelial function of blood vessels, which can accelerate atherosclerosis. Secondly, certain ARTs are known to affect lipid metabolism, leading to increased levels of cholesterol and triglycerides, which are risk factors for CVD.
My work is easy because I use ClickUp. Here's how AI makes complex work simple. With ClickUp Brain, I get AI updates on any project, so I don't have to dig through endless details. When I miss a meeting, Brain gives me a quick recap with all the key takeaways. Even long chat threads are condensed into bite-sized insights, so I can catch up in seconds. And if someone sends me a clip, Brain transcribes it and provides me with a detailed summary. ClickUp makes work easy, from personal projects to running a multi-billion-dollar company. Click the link below to create your workspace for free.
Outshine the sun with new Sunsilk Luminous 100. Gives you 5 times illuminated hair for 100 hours.
Furthermore, traditional risk factors such as smoking, which is more prevalent in the HIV-positive population, and lifestyle factors compound this risk. In John's case, his sedentary lifestyle and smoking history have likely contributed to his cardiovascular issues. Management strategies for patients like John involve a comprehensive approach. Cardiovascular risk assessment in patients with HIV should be an integral part of routine care. This involves regular monitoring of blood pressure, lipid profiles, and glucose levels, alongside HIV parameters like viral load and CD4 count. In treating HIV patients with elevated cardiovascular risk, the choice of ART can be crucial. Some antiretroviral drugs have been associated with an increased risk of cardiovascular events. Therefore, in patients like John, it might be beneficial to switch to ART regimens with a more favorable cardiovascular risk profile. Recent studies suggest that integrase inhibitors, for example, have a lower impact on lipid levels compared to some other classes of ART. Lifestyle modifications are equally. This includes dietary advice to adopt a heart-healthy diet, rich in fruits, vegetables, whole grains, and lean proteins, and low in saturated fats and sugars. Regular physical activity is also recommended, with guidelines suggesting at least 150 minutes of moderate aerobic exercise per week. Smoking cessation is imperative, and John has been referred to a smoking cessation program. Medication for managing CVD risk factors, such as statins for high cholesterol and antihypertensive drugs for high blood pressure, should be used judiciously, considering potential interactions with ART. Collaboration between HIV specialists and cardiologists is essential to optimize care for these patients. Managing cardiovascular risk in HIV-infected individuals requires a tailored approach that considers the unique aspects of both HIV and cardiovascular disease management. It's about adjusting ART regimens, aggressively managing traditional cardiovascular risk factors, and ensuring close monitoring and coordination of care. This comprehensive management strategy not only improves the quality of life for patients like John, but also reduces the long-term cardiovascular complications, ensuring that the successes achieved in the treatment of HIV are not overshadowed by new health challenges.
parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Dr. Thompson. I came in because my legs have been bothering me more than usual, and the numbness is getting worse. It started in my feet years ago, but now it's moving up to my knees. I've lost a lot of sensation in my hands, too.
Good morning, John. It's important that we review these changes thoroughly. Can you tell me more about the progression of these symptoms?
Sure. I first noticed the numbness in my toes back in 1998, and over the years, it just crept up to my lower legs. Recently, I started feeling it in my knees. My hands began to lose feeling about 5 years ago. It's like I'm wearing gloves all the time.
I see. You also mentioned some issues with your right wrist. Could you elaborate on that?
Yes, it swells up a lot, and sometimes it's really painful. My doctor said it's gout and edema. I've been on allopurinol for the gout, and we've adjusted my furosemide for edema recently because of the swelling.
Has there been any improvement with the adjustments?
A little, but it's hard to tell sometimes with the other issues I have going on. The swelling does go down, but it comes back.
And you had a spinal tap recently?
Yeah, that was tough. They tried several times before they got it right. They're looking into what's causing the neuropathy. I'm waiting on those results.
Understood. We'll review those results as soon as they come in. How about your general health otherwise? Any changes in your daily activities due to these symptoms?
Well, because of the numbness and pain, I'm not as active as I used to be. I get tired easily, and I have these periodic fevers and chills. My doctor thinks it might be related to my kidney issues.
Speaking of which, I see here that your kidney function has been a concern. Can you update me on that?
Yes, my kidneys have been a problem for a while. At one point, they said I was at stage 5, but now it's more like stage 4. We're trying to manage it the best we can.
I appreciate your thoroughness, John. Let's go over your most recent lab results and see what our next steps might be. Blood pressure 138/85 mm/Hg, creatinine 2.1 milligrams per dl, EGFR 35 millimn 1.73 millisquared, C-reactive protein elevated at 4.8 milligrams per, which could be an indicator of inflammation or infection. Your lab results show your kidney function is stable compared to previous readings, but still requires close monitoring. Your creatinine is elevated, which is consistent with your chronic kidney disease. The C-reactive protein is a bit high, suggesting some inflammation, which might be tied to several of your conditions.
What do we do next then? I'm really worried about all this, especially with my history of polyps and everything else.
I understand your concerns. Here's what I suggest. First, we need to keep a close eye on your kidney function and adjust your treatment as necessary. I want you to monitor your blood pressure at home and record the readings. We should also consider another nerve conduction study to compare with the last one. Regarding the polyps in your colon, given your family history and the frequent occurrence of polyps, I agree with your previous doctor's advice not to wait too long for the next colonoscopy. Let's plan for that in the next 6 months. For your neuropathy, depending on the results of your spinal tap, we may need to adjust your treatment. It's also essential that we manage your symptoms to maintain your quality of life.
That sounds like a plan. I just hope we can find something to help with the numbness and the pain.
We'll do everything we can. Let's schedule a follow-up in 4 weeks to review your spinal tap results and see how the adjustments in your medications are working. I'll also coordinate with your renal clinic to ensure we're all on the same page.
Thank you, Dr. Thompson. I appreciate you helping me keep track of all this. It's a lot to manage.
You're not alone in this, John. Work through it together. See you in a few weeks.
Questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Diwali's lights may dazzle the skies, but it's the moments in between that make the season truly shine. With a heart of almond and dreamy, creamy coconut indulgence. Raffaello, only for you.
Imagine being able to build anything just by thinking about it. Meet Base 44, a complete AI creation platform made for anyone with an idea and a drive to bring it to life. Describe what you want and watch it take shape. You can plan, customize, and expand in any direction. From tools built for one to platforms ready for many. From passion projects to enterprise-grade systems. Everything is built in and ready to launch. It's a new world of creation, where you can go as far as your imagination takes you. Can you imagine it? Let's make your dream a reality right now.
Doctor, I've been noticing a lot of changes in my health that are concerning me. The first thing is my weight. I've actually been skipping breakfast to try and prevent gaining more weight, but it doesn't seem to be working. I've been gaining weight regardless, and it's very frustrating.
I see. That must be quite frustrating for you. Have there been any changes in your lifestyle or routines aside from skipping breakfast?
Not really. My routine is pretty much the same, but the weight just keeps coming. And there's another thing that's been worrying me a lot. My stool color changed drastically a few times. It started off black, then turned green, and even topaz before going back to normal. I remember reading somewhere that black could mean bleeding in the gastrointestinal tract.
That's correct. Black stools can sometimes indicate bleeding in the upper gastrointestinal tract. Changes in stool color can be concerning, and it's good that you've noticed and mentioned these changes. What about your sleep and your overall mood lately?
Oh, sleep has been rough. I find myself struggling to fall asleep, and when I do, I can only stay asleep until about 3 in the morning. I've been using Advil PM to help, but it's not ideal. Emotionally, it's been tough too. I've been feeling quite down, lacking interest in things I used to enjoy, and sometimes I even have disturbing thoughts about harming others. It's all quite overwhelming.
It's important that you shared that with me. Thank you. Dealing with sleep disturbances and feelings like these can definitely take a toll on your overall well-being. Regarding your breathing, have there been any changes or worsening symptoms there?
Yes, definitely. My asthma seems to be getting worse. I use my Advair and albuterol inhalers, but especially during the early mornings and when it's hot, my breathing really struggles.
Be challenging, especially when they disrupt your daily life like that. Have you noticed any triggers or patterns that seem to worsen your symptoms?
Mainly the weather changes, and sometimes after I visit my parents. They're both not in the best of health, and caring for them adds a lot of stress, which seems to trigger my mood swings.
That sounds quite demanding. Caring for elderly parents can be stressful and could indeed contribute to both your respiratory issues and psychological distress. Let's make sure we address all these points today. I'd like to review your medical management comprehensively and perhaps adjust some of your medications. We should also consider therapy for your psychological distress, as it seems to be impacting your quality of life significantly.
I think that would be good. I just want to feel better and manage these issues more effectively.
Understood. Based on everything you've told me, here's what I think we should do: depression screening. Starting sertraline could help manage your depression symptoms, and arranging regular therapy sessions will provide additional support. For your respiratory issues, we might consider adjusting your asthma medications and possibly adding tiotropium to help manage your symptoms better. Given the variability in your stool, we need to monitor for further episodes of discolored stools and investigate potential gastrointestinal bleeding. I'll schedule some laboratory tests, including for diabetes and cholesterol, since you've experienced recent weight gain. We'll also review all your medications, including omeprazole, and discuss new prescriptions as needed. Lastly, it's important that we schedule regular follow-ups to monitor your chronic conditions and adjust our treatment plan based on your response to these changes.
Thank you, Doctor. It sounds like a comprehensive plan, and I'm hopeful that these adjustments will help me feel better. I appreciate your help.
You're welcome. It's important to address all these issues to improve your quality of life. We'll work together on this. I'll make sure our nursing team schedules your follow-up appointments and helps coordinate the new treatments. If you have any questions, or if there's anything else you need in the meantime, please don't hesitate to contact us.
Will do. Thanks again for your thorough approach and understanding.
Scrub it. Soak it. Stain remover, add it. It will be gone. Almost. Almost? I want it all gone. Only new Ariel Platinum Clean has 10 times stain removing power that means the toughest stains in one wash. No extra steps.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
We need to review the protocol for the central line insertion to ensure we're both clear on the procedure. Have you checked the latest guidelines?
Yes, I've reviewed them. The first step is to ensure the patient is properly positioned, which reduces the risk of complications. Are we using ultrasound guidance?
Absolutely. The guidelines now strongly recommend ultrasound guidance to increase accuracy and reduce puncture attempts. Do we have the ultrasound machine ready?
It's all set up. I'll handle the machine and you can perform the insertion. We also need to remember to maintain strict ASEP technique to prevent infections.
Right. I'll make sure the full barrier precautions are taken. Once the line is in, we need to confirm placement with an X-ray before using the line. Does that sound good?
That sounds perfect. Let's also ensure we document everything accurately.
Now look at question 26.
Welcome everyone. Today we're focusing on ensuring the correct route for each medication, a fundamental aspect of patient safety. Let's start with oral medications. They are the most common route and must be used when the patient can swallow safely. Moving on to IV medications, these are used for faster action, and it's crucial to check the IV site for signs of infection or phlebitis before administration. Always verify the medication compatibility with the IV fluids. Lastly, let's discuss inhalation routes, particularly for medications like bronchodilators or steroids. Ensure the patient knows how to use inhalers correctly and always check the technique to maximize the therapeutic effect. Double-checking the route not only maximizes the efficacy of the medication, but also minimizes the risk of complications. Thank you for attending, and always remember, right route equals right results.
Now look at question 27.
Hello, Mr. Thompson. I understand you're experiencing some pain today. On a scale from 0 to 10, with 0 being no pain and 10 being the worst pain imaginable, how would you rate your pain right now? Okay, you've said it's about a 6. Can you describe the pain? Is it sharp, dull, throbbing, or something else? It's a sharp pain on your left side. Thank you for that information. Has anything helped to relieve the pain, like medication or a certain position? No relief from over-the-counter meds, I understand. Based on your feedback, I'll consult with the physician for a pain management plan. We'll get you feeling better soon.
Now look at question 28.
Good morning, everyone. Today's topic is patient autonomy, an essential principle in healthcare. Patient autonomy respects the patient's right to make decisions about their own health, including the right to refuse treatment. It's important for healthcare providers to ensure patients are fully informed. This means explaining the risks, benefits, and alternatives of treatments in a way that the patient can understand. Let's also remember that respecting autonomy means we support patients' decisions even if we don't agree with them. Our role is to provide the best information and support possible. Fostering autonomy enhances patient satisfaction and can lead to better health outcomes. Let's strive to respect and uphold this principle in all our patient interactions.
Now look at question 29.
Mr. Davies, given your current symptoms and the progression of your condition, we need to transfer you to the ICU to provide you with more intensive support.
What exactly does that mean for my care, doctor? Am I going to be okay?
In the ICU, you'll be closely monitored 24/7 by a team of specialized healthcare professionals. This level of care will help us manage your symptoms more effectively and adjust treatment as necessary.
I'm a bit scared. Will my family be able to visit me there?
I understand it's a bit daunting. Yes, your family can visit during designated hours. We'll do everything we can to make you comfortable and keep your family informed every step of the way.
Now look at question 30.
Today, we're going to discuss patient-controlled analgesia, or PCA, a method that allows patients to manage their own pain post-surgery or during severe pain episodes. PCA devices are programmed to deliver a preset dose of pain medication when the patient presses a button. It's a safe way to manage pain, as it has limits to prevent overdose. One of the major benefits of PCA is that it provides patients with control over their pain management,